Welcome to Parkinson's Disease, The Essentials. This is a presentation from the American Parkinson Disease Association. Thank you for joining us. This presentation is an overview of Parkinson's disease, or PD, its symptoms, risk factors, and treatments. It is also an overview of how to manage well with this disease and how APDA can help. Please remember that any medical information provided is solely for the purpose of providing information and is not intended as medical advice. Our healthcare professionals cannot recommend specific treatments or make a diagnosis. We encourage you to direct any specific questions to your personal healthcare providers. Before we begin, there are a few important points that I would like to highlight about PD. First of all, there has been tremendous progress over the past number of years in our understanding of PD and the development of treatments for PD. Our motto at APDA is Strength in Optimism, Hope in Progress. This guides us every day. In addition, PD is highly individualized from person to person. Not all that is discussed today is relevant to everyone. PD impacts not only the diagnosed person, but his or her family, social networks, and community at large. The healthcare team must be familiar with signs and symptoms, treatment strategies, and how PD impacts an individual patient. Finally, treating PD requires a team approach. This may include a neurologist, physical therapist, occupational therapist, speech therapist, psychologist, social worker, and others, depending on the individual needs of the person with PD. To put Parkinson's disease in historical context, you are looking at the first page of a manuscript written by Dr. James Parkinson in 1817 called An Essay on the Shaking Palsy. This is the first medical description of what became known as Parkinson's disease. With that as background, let us begin our discussion of what is Parkinson's disease. Parkinson's disease is a brain disorder that can affect a person's ability to perform common daily activities. Symptoms of PD are generally divided into motor symptoms, those that affect movement, and non-motor symptoms, those that do not involve movement, such as sleep disorders, constipation, or depression. Motor symptoms are typically due to a lack of a brain chemical called dopamine. The substantia nigra is an area deep within the brain that communicates with other areas of the brain using the brain chemical dopamine. Proper dopamine signaling is critical to produce normal movement. The cells of the substantia nigra degenerate in PD, leading to a lack of dopamine and difficulty with movement. Many other types of nerve cells in the brain degenerate in PD as well, which causes many of the non-motor symptoms. The primary motor symptoms that are part of PD and can be used to diagnose it are tremor, which typically happens when a body part is at rest, rigidity or stiffness of movement, bradykinesia or slowness of movement, and postural instability, which is a difficulty maintaining balance. We often think of the motor symptoms of PD like the part of the iceberg above the water. These are the symptoms that are visible to other people. The non-motor symptoms are the part of the iceberg beneath the water. These symptoms are not visible, but nonetheless can be very problematic. Not all non-motor symptoms occur in everyone with Parkinson's disease, and the severity varies from person to person as well. Non-motor symptoms of PD are typically divided into three major categories: neuropsychiatric, sensory, and autonomic. Neuropsychiatric symptoms include problems of mood, sleep, and thinking. Sensory symptoms can include pain, as well as changes in vision and smell. Autonomic symptoms involve functions of the body that are not controlled consciously, like poor blood pressure regulation and urinary dysfunction. There may be other, less common non-motor features as well that are not listed here. Let's review some Parkinson's disease statistics. In the United States, there are approximately 1 million people living with PD and 90,000 new diagnoses every year. This equates to a new diagnosis every 6 minutes. The average age of onset is about 60, but approximately 10% of diagnoses occur before age 50. This is referred to as young onset PD. Finally, men are 50% more likely to get PD than women. A study in 2019 calculated the economic burden of PD in the United States and found that over $50 billion is spent every year, with half of that amount shouldered by the government and half shouldered by people with PD in the form of copays, lost wages, and other out-of-pocket expenses. There are a number of risk factors associated with Parkinson's disease. First, there is a male-to-female ratio of diagnoses of 3 to 2. That is, as we said previously, men are 50% more likely to get PD than women. There are also a number of environmental and genetic risk factors, which we'll discuss in more detail in a moment. And finally, age is a risk factor, with incidence of PD increasing with age. Let's look at genetic risk factors for PD. More than 20 genes have been identified as potentially contributing to PD risk, and there may be many more that have yet to be identified. Currently, most people with PD do not have one of the known genetic mutations already identified to increase PD risk. Having a first-degree relative with PD modestly increases a person's risk of developing Parkinson's. As we understand more and more about genes that contribute to PD risk, we'll be able to increase our understanding of who may develop Parkinson's. Now let's look at environmental risk factors. Certain environmental toxins, such as particular pesticides and solvents, have been implicated in increased PD risk. Traumatic brain injury can increase risk as well. It's important to note that genes and environment work together to affect PD risk, and some environmental factors may be more significant in those with particular gene mutations. When it comes to PD diagnosis, certain findings on exam are so characteristic of Parkinson's disease that a neurologist is usually able to make a diagnosis by examining the person. Therefore, clinical exam remains the gold standard for diagnosing Parkinson's disease. However, sometimes the diagnosis is more challenging, and there are 3 commercially available tests to help with diagnosis. It is best if the neurologist or movement disorders physician orders and interprets these. An SA-Amplify (ASYN) test detects alpha-synuclein pathology in cerebral spinal fluid. SYN-1 detects phosphorylated alpha-synuclein in skin biopsy. A DAT scan, or dopamine transporter scan, is a brain imaging test of the dopamine system. A decreased signal in a particular part of the brain correlates with a PD diagnosis. This slide illustrates the most widely recommended treatments for Parkinson's disease, which include medications, physical, occupational, and speech therapy, and brain procedures such as deep brain stimulation and focused ultrasound. We'll now discuss each of these in more detail. A number of important points about medications are listed on this slide. A lot of current research is focused on finding a therapy that protects neurons from degenerating in PD, but this type of treatment is not available yet. Available treatments help to control the symptoms of PD. The goal of medication management is to get the right dose without significant side effects. Regular adjustment of the dose and timing of medications are key to effective treatment. Because each person is different and we process medications differently, the responses to the medications may also be different. PD may best be treated with a combination of medications, as each medication has a different effect on the brain. The next few slides are tables of all the available medications for Parkinson's disease in the United States. Of note, this list was updated as of February 2025, and new medications may have been approved since then. The first category is different formulations of levodopa, a chemical which gets converted to dopamine in the brain. Most of these formulations also contain carbidopa, which prevents levodopa's breakdown in the bloodstream. In this way, more of it can cross into the brain where it is converted to dopamine. The different formulations are immediate release, extended release, subcutaneous infusion, intestinal gel, and inhalation powder. Levodopa remains the gold standard of treatment of PD and is typically the most effective medication in treating the motor symptoms of PD. It must be emphasized that levodopa is not toxic and does not cause faster progression of PD. This is a common misunderstanding. COMT inhibitors are another class of medications which prevent the breakdown of levodopa in the bloodstream. COMT inhibitors must be taken along with levodopa. Anticholinergic medications improve dopamine signaling in the brain. However, they can have many side effects, including effects on thinking and memory. They are therefore used sparingly, particularly in older populations. Dopamine agonists mimic dopamine in the brain. They are available in many formulations: short-acting, long-acting, injectable, subcutaneous infusion, and patch. They need to be used carefully in the elderly due to potential side effects. Adenosine 2A inhibitors act on a particular set of neurons in the brain to enhance dopamine signaling. MAO-B inhibitors inhibit the breakdown of dopamine within the brain to allow it to signal for longer. Amantadine, immediate and extended release versions, acts in more than one way to improve PD symptoms. For many people, it is very important for medications to be taken on time. Missing a dose or being late for a dose can greatly affect symptoms. If it is unclear to a person with PD how their medications are affecting symptoms, that person may be advised to keep a diary, which keeps track of medication timing and symptoms. The neurologist will review the diary to try to determine how best to change medications to improve symptoms. APDA has developed a symptom tracker mobile app which helps people with PD keep track of their symptoms and medications, and to relay that important information to members of their medical team, with the ultimate goal of receiving better, more personalized care. You can download this app for free via the Apple App Store or Google Play. We'll now discuss another integral component of PD treatment: physical, occupational, and speech therapy. Physical therapy can help improve balance, walking, and strength. Speech therapy addresses speech and swallowing difficulties. And occupational therapy can improve fine motor skills and promote independent living. Another approach to treating PD is through a brain procedure. Deep brain stimulation, or DBS, is a surgical procedure in which a wire is placed deep within the brain and then tunneled under the skin and attached to an implantable pulse generator, or IPG, in the chest. The IPG can be controlled to deliver electricity to the deep parts of the brain that regulate the circuitry that is not working properly in PD. Deep brain stimulation can be helpful for those who do not get consistent improvement from their medication doses. Focused ultrasound is another brain procedure that is approved for treatment of Parkinson's disease. In this treatment, focused beams of ultrasound energy converge within the brain tissue to form a small lesion that interferes with the brain circuitry. Besides the treatments that the healthcare community will provide, you are an important part of managing this disease and living well. Exercise is an essential part of living well with PD. Exercise can help manage symptoms and improve quality of life, while being sedentary and deconditioned can increase stiffness, stooped posture, and poor endurance. The Center for Disease Control recommends 150 minutes of moderate intensity or 75 minutes of vigorous intensity exercise per week for all older adults. Consider the 4 different kinds of exercise in your regular exercise program: aerobic, strengthening, stretching, and balance. Diet is another element of your lifestyle that you can control. Despite numerous clinical trials of various nutritional supplements, No specific supplement has been proven to help PD. However, here are some key principles regarding PD and nutrition. Be aware that for some, dietary protein can compete with levodopa to cross the small intestine, making medication doses less effective. If this is a problem for you, you may need to adjust your intake of protein during the day. Constipation, which is a common non-motor symptom in PD, can be treated with plenty of fluids, specific foods, and regular exercise. Low blood pressure, another common symptom in PD, can be treated with fluids and liberalization of salt. Weight loss can complicate PD, but can also be a sign of other medical conditions. Talk with your doctor if you are experiencing weight loss. Brain health may be enhanced by adherence to the Mediterranean diet, which includes vegetables, fruits, whole grains, legumes such as beans, peas, and lentils, nuts, low-fat proteins such as fish and poultry, and olive oil. A team approach to your healthcare is essential, with you at the center. A movement disorders specialist is a neurologist who has undergone additional training in Parkinson's disease and related disorders. Consulting with a movement disorders specialist can help you achieve the best medical management of your PD. Your movement disorders specialist can partner with many other healthcare professionals to help you in your PD journey. APDA can be a key element of your team, providing a wide range of Parkinson's disease programs, resources, education, and support. APDA can help you live your best life with PD. Every day, we provide the support, education, research, and community that helps everyone impacted by Parkinson's disease live life to the fullest. We are here for you. APDA is a grassroots network dedicated to fighting Parkinson's disease. We are the boots on the ground, and we are here for you every step of the way. In our effort to help everyone impacted by PD live life to the fullest, we provide programs and services across the country to help people do just that. We have 3 areas of focus: information and referral to help people get connected to the care they need, education and support to equip people with the information they need and the ability to find sources of support and camaraderie within their communities, and health and wellness to get people moving in ways that are specifically designed for people with PD to help them feel better, to relieve symptoms, to have fun, and much more. No matter where you live, APDA is here for you. In addition to the resources we have on the ground, we can connect with anyone, anywhere, through our extensive website and our toll-free number. There is a tremendous amount of useful content on our website, including info about the disease itself, education and support, details about the research we fund, and more. We have an extensive list of free fact sheets and booklets available for download on our website, or you can order hard copies to be mailed to you. These fact sheets and booklets range from PD symptoms like fatigue, depression, and constipation, to exercise, to a guide for veterans, and so much more. They are reviewed and updated periodically, so you're always getting current info, and new publications are added as needed. Almost all of our publications are also available in Spanish, and some are available in simplified Chinese. In addition, APDA has a wealth of virtual programming to help you understand the ins and outs of Parkinson's disease and live life to the fullest, and so much more. These are a number of resources that you can find on our website, apdaparkinson.org, and on our YouTube channel to help you further understand Parkinson's disease. There is also information about our Symptom Tracker mobile app, as well as how to get involved in APDA near you. In addition to the programming that we provide for people with PD, we fund research focused on bringing new treatments to people with PD and ultimately finding a cure. We proudly invest in the most promising clinicians and scientific projects. The bottom line is that APDA is here for you. Our tagline, Strength and Optimism, Hope in Progress, highlights the work we do every day to help everyone impacted by PD live their best lives, to educate and support them so they can live with optimism. It also speaks to the research we fund and the hope we have for the future. You can contact our chapters directly, and of course, you can always reach out to us at our national toll-free number or online, and follow us on social media so you can stay up to date on our latest news and events. If you'd like to get more involved or fuel our mission with a donation, we welcome that support, as we cannot do our work without your help. Thank you.